Hi, my name is Nick from the Center for Risk Analysis. In today's video, we've taken a clip from our recent briefing with PANDA data scientist Ian McGorian, in which Ian talks about the potential for a second wave of coronavirus in South Africa, as well as some of the bad modeling which has taken place throughout this pandemic and the misallocation of resources that it has caused. Take a look.
The stuff that we have done in this country and the stuff that has been done around the world has been based on SIR or SEIR models. And PANDA has spent a great deal of time and effort in showing these models and what we think of them and how we criticize them has obviously had wide coverage. But I just want to do a quick reality check. These are the two official government models. The blue line is their optimistic model and the red line is their pessimistic model. The black line is the actual deaths that have occurred up till yesterday. So you can see that these models are not out by a couple of thousand, they're out by orders of magnitude. You know, it's actually becoming a little bit, it has been from the beginning, but it's becoming more and more distressing that the government continues to talk about 40,000 to 50,000 deaths, which is the official model. If you look at this graph, we should have been there already. We are nowhere close to that. We are unlikely to get close to that. You can see that our death results are dropping off dramatically every day. But these models do another thing. They drive resource allocation. So if we take the American example, they had USS Mercy parked outside New York Harbor throughout the crisis. It left New York Harbor having treated 175 patients. XL London, 51 patients before they closed it down. The Florence Nightingale Hospital that was set up at XL, the Javits Center in America was closed down, having seen just about plus minus 1,000 patients. Now, I've got my numbers from DATCOV. I do recognize that there have been other numbers thrown around, but just consider this: Nasrec, 1,500 beds, and it had a total of 501 admissions. Cape Town Convention Center, 800 beds, 471 admissions through the whole thing before they got closed down. So if you take Nasrec as a simple example, at the 1,500 beds, 501 admissions, it cost 350 million rand, Nasrec. So that's 680,000 rand per patient treated there. Looking at the 1,400 field hospitals that were contemplated by government, for the data that we have scraped, and we've scraped on 591 all hospitals, field and outside, etc., district in general, we see in the field hospital that there was a utilization of less than 9%, which is pretty scary. It's been a massive waste of money and resource and time, and just a harbinger of fear. To put that in perspective, the government model for hospital beds and intensive care beds, there you see the blue line again is the optimistic, the red line the pessimistic, and the black line at the bottom is the actual utilization. So you can see that for beds, it was overstated by 18 times. The optimistic view was overstated by 14 times. We're not talking small mistakes here. We're talking about, consider this, in total there have been 86,178 admissions into hospital, total admissions. These models are talking about 80,000 admissions in one day. We haven't even got there in the entire time. That's what we mean about gross. The modeling has been grossly wrong. So second wave, well, coronaviruses are seasonal. Every other coronavirus has proven to be seasonal. So why wouldn't we expect that from this one? It would be astonishing if it wasn't. The first wave has shown probably the dry tinder effect. And the dry tinder effect maybe not a pleasant term, but it simply says that those people who were susceptible and who were likely to have a bad outcome from contracting corona, well, it's gone through, and they've either been hospitalized or they haven't recovered. We know that that coronaviruses do not mutate very quickly, and this one in particular is not showing itself to mutate very quickly. So there's no reason not to see it as what else could explain it. So our contention is that, yes, we do need a reset, and there's no doubt about that, but the only reset that is really required is one for some critical thinking and some rational risk assessment. And, let's really start being clever about what are we dealing with and how are we dealing with it, and what damage are we causing in the process of dealing with it.
If you liked this video, be sure to give it a like and subscribe to our YouTube channel. For more about our strategic intelligence services, be sure to follow the link in the description.